Hello everyone, Dr. Sindhu Ravishankar. In this video, you're going to learn about breast cancer screening programs, and who are the people who are at high risk to get breast cancer, and what are the screening modalities available to screen yourself for breast cancer, and how to do breast self-examination. So why it is so important at this period of the year to know about it, because October month is breast cancer awareness month of the year. So it should not be confined to the only for the month of October, where you should be aware, or where you should be screening for yourself for breast cancer. So throughout your life, every woman should know what is breast cancer screening and how to do breast self examination. Why it is so important? Because every year around 2.5 million people get affected by breast cancer, and there are more than 250,000 deaths due to breast cancer. It is so common. It is one of the leading causes of death in women as well. So it's very important for us to be aware of the signs and symptoms of breast cancer, and if you are by any chance at the high risk to get breast cancer, and you should definitely know how to do breast self examination and what screening modalities are available to screen yourself. Screening is nothing but where screening of breast cancer will not definitely prevent the breast cancer. It will definitely help to diagnose the disease early, and you can get the treatment early. If the staging of the breast cancer is very, very early, the treatment the survival rate or the outcome of the treatment is very, very good. So it's very important to know those facts. Okay, first and foremost is what are the category of people who are at high risk for breast cancer. First and foremost is plot your family diagram, in the sense, okay, just ask your mom, your mom's mom, your grandparents, or your aunts, anybody in your family have ever suffered with breast cancer or ovarian cancer. Okay, so when you talk about family history of cancers, it's very important, because if at all, there are two types of genes in our body called BRCA1 and BRCA2. These genes are there in everybody. If there is any defect, if there is any abnormality in those genes, so that puts you at a higher risk for breast and ovarian cancer. So that is little more higher if you have any family history of breast cancer, and if that person who have had a breast cancer or an ovarian cancer had the mutation in these genes. Okay, if you have a family history, and if you don't know whether that person was have affected with this BRCA1 or BRCA2 genes, so get yourself checked for it. So presence of BRCA1, BRCA2 gene mutation, that doesn't mean that definitely you will get the cancer. It definitely puts you at a high risk category to get the breast cancer. So for you people, the screening of breast cancer is very, very important. So it's very, very important to know your family history of breast or ovarian cancer. Okay. Second category of people is if you have attained puberty very, very early, in the sense if you attain menarche less than 12 years of age, and if you have attained menopause beyond 55 or 50 or 53, 55 years of age, because the amount of duration of period your body has been exposed to estrogen is more. So those category of people are also at high risk for breast cancer. And third category of people are who have used oral contraceptive pills in their lifetime. In the sense, if you have used oral contraceptive pills for more than 3 or 5 years of age, it will definitely reduce your risk for ovarian cancer, but in turn it will definitely puts you at a higher risk for developing breast cancer. Not everybody who uses oral contraceptive pills will get breast cancer. Just the thing is, you will be at a higher risk. That means you need to undergo routine screening for it. So these are the three important category of people. And fourth one is if you are nulliparous, means if you have never breastfed the baby. Okay, if you have never breastfed, so that also is one of the risk factor. If you have dense breasts, if you have huge breasts, that's also will put you at a high risk for getting breast cancer, because dense breasts, sometimes it's very hard to penetrate and find the smaller earlier stages of the cancer. So that's the reason they put them at a higher risk for breast cancer. So if you fall into any of these categories, you should definitely have to undergo yearly screening once you reach 40 years of age. Yeah, so less than 40 years of age, it is not routinely recommended to undergo screening for breast cancer. But if you have a family history, there is nothing wrong. Less than 40 years of age, if you have any of these categories, you can undergo ultrasound of the breast. And more than 40 years or 50 years of age, you should do a mammogram. Yeah, mammogram is the screening modality for your breast cancer, for the early detection or the early prediction of the breast. Next thing is, okay, you are having any cysts or anything in your breast, like fibroadenomas or cystic diseases or anything like that. So does these category of people will have a higher risk for breast cancer? No, there is no studies or no evidence to support that. Fibrocystic or fibroadenoma is a benign condition. It's a non-cancerous condition of the breast. You don't have to worry about it. Only thing is, you need to keep monitoring it every yearly once to know whether the size is increasing or whether any new pain is developing in those cysts. If it is, many people will have it throughout their life without any problem also. So in any point of the time, if it is increasing in size or if it is unnecessarily causing you any kind of pain or anything, that definitely needs to be investigated. Maybe you need to undergo a biopsy or something like that to make sure that it is non-cancerous. Okay, so these are the people who should be very much vigilant when it comes to your breast cancer screening. So what are the screening modalities? Screening modalities are the breast ultrasound if you're less than 40 years of age. But the WHO, the CDC, all the studies and everything, they say there is no need for routine screening if you are less than 50 years of age, because breast cancer is seen most commonly in the elderly people. That doesn't mean it is not seen in the younger people. It is definitely seen in the younger people also. That again, it puts you, if it is always categories based on whether you are at a high risk or a low risk. Or if you have any doubt, if you have any family history, or if you have any doubts regarding that, go to your doctor and discuss with them whether you are at a high risk or at a low risk, or how frequently you should be having your screening and everything. So that will definitely solve the problem there. Yeah. So next thing is how to do breast examination. So these are the things are definitely there, the screening things, the high risk categories and everything. So generally every woman, okay, should know how to do breast self examination. Okay, you might not want to go to the hospital every time to get yourself checked. So it is very much possible at home itself if you follow these 5 steps when you are doing the breast examination. First and foremost is you have to undress yourself and stand in front of the mirror and observe your breasts. Okay, just see whether you see any difference, because there is no typical or identical breast which is said to be normal. Each and every person will have different sizes and different shapes for that matter. So you will be the best person to notice any kind of changes in your breast which is happening. So first and foremost is undress yourself, stand in front of the mirror and with your hands on your hips and observe, okay, whether you see any changes, whether any size differences there, you see any puckering of the skin, you see any lump which is seen outside, is there any discharge coming out of the nipples or something like that. Okay, so next step is you have to lift your hands overhead. Yeah, you have to lift your hands overhead, and then again you observe for all these things, yeah, the size, the shape, or any discharge or anything, any change in the color of the skin or anything. Okay, this is your inspection. Next is you can lie down flat and using your fingertips, yeah, using all fingertips, you can run through your breast from side to side and up to down. Yeah, so if you see any kind of if you feel there is any kind of lump or anything like that, you should immediately go to the doctor. This is how you screen. Okay, this is how you check. Okay, first is inspection in standing in front of the mirror, and the second or the third part is lying down flat on the bed. You can screen yourself. You can palpate your breast from above to below and side to side. You can do a self breast examination in the shower as well. That is the best way, because the water will give you the moisturization also. The palpation and everything is much better when you are in the shower. So each time, okay, once in a while, once in a month or something like that, okay, whenever you remember it, so try to palpate for your breast and try to look for any kind of swellings or the lumps or anything you're feeling inside your breast. Okay, so these are the 4 or 5 steps which you need to follow to do the self breast examination. Okay, so it's very simple. You don't want any kind of special things to do this. It's at home. You yourself can do it. If you see any doubt, if you see any changes in yourself, you should definitely get yourself checked. Okay, So I guess that's about your breast cancer screening and the breast self-examination. So share this video with your friends and family, with your mom. Tell everybody whom you know this is the month where you should definitely create awareness about breast cancer. It's not sufficient if you yourself are self-aware of it. It's the time where you should definitely spread a word and create awareness about this with everybody. Yeah, I hope you'll do that. If you like this channel, consider subscribing. I'll see you all in the next video. Till then, take care and bye bye.